So this video is about trends in non-surgical and surgical facelifts. It might seem that there are hundreds of different types of facelifts out there. There are non-surgical facelifts, there's liquid facelifts, there's lunchtime facelifts, and there's all kinds of different names for actual facelifts. And so we'll try and demystify this a little bit if we can. So we'll talk first about what is a traditional surgical facelift. And this is what a facelift, that's what the term facelift means. It's a surgical procedure. It's aimed at elevating the skin, the underlying muscle, to reposition the facial volume, tighten the facial skin. And this is something that, unfortunately, does require surgery. You need to incise the skin, it needs to be removed, so there's a scar that it results from that. And it's very well hidden in and around the ear and the hairline. It's not really an issue. But some people like the idea of trying to do a surgical procedure without actually doing surgery. And so, there's this advent of all kinds of non-surgical techniques to try and mimic that. So one of the trends we're seeing these days is minimally invasive surgeries. So what does that mean? I think in general, what we try and do as surgeons, and we've always tried to do as surgeons, is try and focus on techniques and procedures that can get a good result without being too invasive. So lifting less skin, making a smaller incision, not opening up the neck in patients that don't need it, not performing ancillary procedures like blepharoplasties or brow lifts in patients who don't need it. So we're constantly trying to make our surgical techniques more efficient, trying to do less surgery and get the same result. But there's a point at which there are surgical principles that you really, and laws of physics that you really have to abide by. And if you're not actually pulling on something in a very specific direction, or if you're not removing skin when there's extra skin, you're not going to achieve the result that you are hoping. So at this stage in history, we certainly don't have technology that can specifically move your jowl up along your jawline, or volumize your cheek, or remove extra skin without doing that surgically. This is very precise, delicate work. It requires years and years of experience. It requires years and years of training. And I don't think you can expect a machine to just be applied to your skin and suddenly give you a facelift. So, I think, if something sounds too good to be true, so it's important as surgeons that we constantly try and develop less invasive techniques for the procedures that we're doing. But you have to be aware that sometimes these minimally invasive techniques are just not adequate for some people. They may help, but they may not give the improvement that they are hoping for. And I think a lot of times people can be disappointed by these techniques. I'll give you an example of the mini lift. This is a procedure that has become very popular. It's something that I do a lot of. I think it's a terrific surgery. However, I really think it focuses mainly on sharpening the jawline. And some patients just have a little bit of laxity. Sharpening it looks great. No other issues, and I think it's a terrific procedure. Why do a big facelift for someone that just needs a little bit of jaw tightening? Now, the other side of the coin is those patients who have a loose neck, who look very heavy in the neck, and it's out of keeping with the rest of their features. A mini lift's not going to help them. And although they want to do something less invasive with a shorter recovery period, I think that they're doing themselves a disservice by not addressing some of the significant laxity that they have by doing a proper facelift. So although there's lots of different ways of performing surgeries, I think that some of the less invasive ones, although they're very helpful, they're not right for everybody. The next trend is the non-surgical trend. And this is a huge part of our practice. We do laser resurfacing, all types of broadband light treatments, botox, fillers. Any non-surgical treatment that's available for facial rejuvenation, we do. And so I'm a big fan. But what we don't do is we don't call them facelifts. There's no such thing. Adding volume to someone's cheek does not give you a facelift. Using botox around the eyes, or heaven forbid in the neck, which I don't understand why people would do, that doesn't give a facelift at all. What botox and fillers do is they specifically treat wrinkles, volume loss, and they're fantastic for that. They're much better than the facelift surgeries that I do for what they do, but they're not surgery. So some of the terms you might hear are liquid facelift, lunchtime facelift, thread lift, These are all procedures that have an effect, but the effect is not that they are equivalent to or anywhere near what a facelift is. They're totally different. So a liquid facelift, which is really revolumization of some of the subcutaneous fat pads, is very helpful. In patients who have volume loss, perhaps in their 30s, early 40s, flattening of the cheek, hollowing of the temples, this is a great technique. Even patients who have a slightly small chin that in the past might have considered having a chin implant can often get significant augmentation of the chin with a simple in-office treatment. These are great treatments. They're just not facelifts. I don't want to say that these are not useful treatments. They're fantastic. It's just I think you have to be very careful not to expect a facelift result from something that is not a facelift. The next topic is surgical facelifts that are marketed as lunchtime or weekend. Often they're not actual facelifts at all. So there is not a surgical incision, there's no elevation or removal of skin. Sometimes practices will market broadband light treatments or ultrasound treatments that heat the skin, that cause a little bit of skin tightening as a facelift. So just be cautious about that. Ask them to provide you with detailed explanation of what's going to be done. If it's actually a device that's being used or fillers that are being used, that's not a facelift. I think, get them to be a little more truthful with you about what the procedure really is. So I think if someone's doing an ultrasound treatment on your face and calling that a facelift, sure, you're going to recover over the weekend, because you actually haven't had a facelift. So just make sure you're comparing apples to apples when you're deciding on the type of procedure that you want to have. I'm not saying that skin tightening procedures or laser procedures on the face aren't good. I think they're excellent. It's just that they're not going to do the same thing as a facelift. And if you don't need a facelift and what you really need is just some skin tightening and resurfacing of your skin, that's what you should do. I just don't think practices should really be calling those facelifts. So that wraps up our video on some of the new trends in facial rejuvenation surgery. And in the next video, we're going to talk about some very effective and valid non-surgical techniques for improvement in facial aging.